Hi, this is Dr. Gary Sykes. I'd like to discuss with you how much does it cost to have private pregnancy care. Well, firstly, the bill will vary according to whether or not you are insured or not insured. So if you have adequate private health insurance, then the out-of-pocket costs will be significantly less. The first bill is our bill. What do we charge? Well, there'll be a gap to pay us for your initial consultation and your management fee. All other visits with us, your delivery, my managing you in hospital, your 6-week postnatal visit, you won't see any bills because we will be reimbursed by Medicare and your health fund. So you won't see that. So it's only the initial consultation and the management fee. Now, my secretary, if you phone the office, can tell you what that will be, so you have a very good idea of what your out-of-pocket expense is going to be to me. By the way, we do a 2D, 3D, 4D ultrasound scan of your baby every visit. We give you a USB at the first visit, and these scans we don't charge you at all. Now, moving on to the topic of scans, as I said, our ultrasound scans, there's no fee, but you will have to have external scans done. I prefer a specialist pregnancy unit to do it, and so there will be a gap to pay. Some patients prefer to go to a general radiology practice where they'll be bulk billed. The trade-off is they don't have that level of expertise, and there is certainly a greater possibility that they could miss something which could have huge implications. So while it may be free, there is that trade-off, greater risk. Next bills will come from other doctors. Other doctors would include, for instance, an anaesthetist if you had an epidural in labour or a caesarean section. If you get diabetes in pregnancy, an endocrinologist, your baby will be checked by a paediatrician and so on. So there will be other doctors involved in your pregnancy care. Now, for these doctors, there will be a gap to pay. It does vary. We can give you some idea when you contact us, but ultimately we're not sure because we're not sure which anaesthetist will be involved in your care, which paediatrician will be looking after your baby and so on. So, but there will be gaps to pay there. Pathology, we will request bulk billing for all the routine pathology that's done, so there'll be no out-of-pocket there. There will be an out-of-pocket though for an NIPT if you get that done, because there's no Medicare rebate on that, so that will be a charge. And there may be some specialised tests that you that you need, for which there will be a gap to pay. The hospital, well, there will be an excess to pay if you're in a health fund, maybe not. Depends on your level of cover with that health fund. If you're not in a health fund, then you'll be expected to pay the full hospital amount, because Medicare does not contribute to that hospital bill. Norway has a package, a 2-day or 2-night stay package and a 5-night stay package, so you can prepay the hospital bill so you know where you're up to, what's happening before you have your baby. But that's for assuming everything goes well. If things don't go well, not insured, there will be extra expenses, there may be extra stay, extra things that have to be done. Worst case scenario, you may end up having to go to ICU or the baby having to have a prolonged stay in the special care baby unit. All these expenses can be there, not commonly, but they can be there. So you should think about it and maybe a budget a bit for that one as well, if you're not in a health fund. If you have any queries, you want to know more information, more detail, then please give my office a ring and have a chat to my secretary.